Hi, this is Ryan's Abdominal Assessment. My patient is going to be my father. I have him lying in a supine position because that's optimal for an abdominal assessment. I'm going to start with a quick few health history questions. Have you been experiencing any abdominal issues, gastrointestinal issues recently?
No.
Problems urinating? Problems going to the bathroom?
Nothing.
Problems starting a stream?
No.
Okay, I asked that just because males who have problems starting a stream often have, that's indicative of prostate issues. If he was a female, I would ask about his last menstrual cycle. With that being said, I'll move into inspection. So with inspection, we're looking at the four quadrants of the abdomen. The right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and we're going to be performing all four procedures in a clockwise pattern, starting at the right lower quadrant. Looking at his abdomen here, I'm gonna allow everyone. I'm gonna allow him the privacy of keeping his shirt on. But we're going to say his umbilical is definitely midline. His skin, we would expect to be the same color as his skin tone throughout his entire body. We are assessing for hernias. Dad, can you pick your head up? When the patient raises their head, you might see a protruding bulge down here, indicating a hernia. Also, on a very thin, you can put your head down, Dad. On a very thin person, you might see some pulsations around the aorta. And that's about it in terms of inspection. Oh, also the contour of his abdomen is rounded. As I said, someone who had a scaphoid or inward shaped stomach who is very thin, you might see with that type of shape. More distended, which is someone who has an enlarged stomach, which can be indicative of edema, fluid being filled in that area. From there, we're going to move to oscillation. So for oscillation, we're going, as I said, we're going to start in the right lower quadrant. We're listening for bowel sounds, preferably 5 to 30 sounds per minute. And if we didn't hear those 5 to 30, we would listen for a full 5 minutes for normative, hyperactive bowel sounds. But we'll take a quick listen and see what's going on. Again, starting in the right lower quadrant, using the diaphragm of the stethoscope, we're going to move clockwise. Okay, for time purposes, we're going to keep it short, but everything sounds normal. Now we're going to actually listen for vascular sounds. Well, we can listen at four artery areas: the aorta, which is going to be halfway between the xiphoid process and the umbilical. Then we're going to listen to the renal artery, which is just a little to the side and below. Then the iliac, which is below the renal, and then if you needed to, the femoral. In this case, I'm not going to have my father pull down his pants, so we're going to stop at the iliac.
Thank you.
And with doing this, we're going to use the bell of the stethoscope. Again, starting at the aorta. And what you're listening for is a swishing sound. We're looking for bruits, which are indicative of blocks of the artery. Again, these should be easily heard. And if I was listening to the femoral, it would be down somewhere around here. Keep in mind you can listen to the renal, iliac, femoral on the right and left side. Obviously, you want to do that when you're examining a patient because you could have a block on either side of the arteries. Moving from oscillation, we're going to go into percussion. Percussion, I'm going to percuss all 4 quadrants to start. We're listening for a tympanic sound because his stomach should be air-filled. A tympanic sound is like a drum-like sound. And like I said, it's because we should be over air-filled spaces. We don't want a dull sound. So I'm going to start by just using my ring finger and my middle finger and percussing all 4 areas. And with that, we heard the tympanic sound we're looking for throughout all 4 areas. Now, from there, because we have time constraints, I'm just going to percuss for the liver border. We're going to start right around the umbilical, and we're going to move upwards towards the start of the rib cage. And again, we're listening for that tympani, but when that tympani stops and we hear a dull sound, that's when we're going to mark a line for our liver, or for the start of our liver, I should say. So right there is where I would mark the line for the start of his liver. Now, to assess further into the rib cage, we're going to have to look for the spaces within the intercostal spaces within the rib cage. So again, moving upward from where we drew our line, if Ishtar was off, we would have drawn a line. I'm looking for those spaces. And again, you're listening for that dull sound. And for him, I hear just about there. So I would say that would be what I would call the length of his liver. I don't have a tape measure out, but ideally you want your patient's liver size to be between 4 to 7 centimeters. With that, we're going to move on to palpation, which is we do light and deep. Always light first. We're going to go to a depth of about 2 centimeters, and then with the deep palpation, we're going to go to 4 centimeters. As I go through this, Dad, I'm just going to ask you if you experience any tenderness, okay, in these areas.
No problem.
Nothing?
Nothing.
No pain? Okay. And aside from just his response of tenderness and pain, you're looking for rigidity, you're feeling for masses, which I don't feel. With that, I'm going to go into deep palpation. Some people do it with 1 hand, I'm going to do it with 2. And again, this is going to be to about 4 to 5 centimeters in depth. Again, tell me if you're experiencing any pain with this. And we're feeling for any rigidity, masses, anything just abnormal. You okay?
Yep, no problem. No problem.
Okay. So with that, we're going to conclude the video. Again, there is several tests that you could do using the palpation process, but we don't have time for that, so that's going to conclude the video. Thank you for your time.